United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Welcome to our march for just one step closer to spring. I hope everyone is ready to connect, communicate, and influence your way to better business. To get started, please take a few minutes to go through the folder at your tables. You'll find information on our sponsors, along with a perk brochure with contact information for today's newest chamber members. You can also visit the Chamber's website, www.saginawchamber.org, anytime to find event dates, legislative updates, and living local offers from fellow members. Let's support each other and conduct business locally whenever possible. And now, please join me in welcoming your 2020 Chamber Ambassador Chair, Dawn Bauscher, with our newest Chamber members. Come on up, Dawn.
the Chamber's newest members today, and on behalf of the ambassadors, we're looking forward to helping them make connections with all of you as they become part of our Chamber community. And now, let's meet our new members. Will the associates of G's Pizzeria Bar and Grill please stand? G's Pizzeria is a family-owned business that opened its doors in 1983 in West Branch. They now have 8 locations, including Saginaw, Bay City, and all adhere to the company's founding philosophy. If you give good quality food at a fair price in a warm, friendly environment, people will come. Thank you for joining us today, and welcome to the Chamber. And now will the associates of Jazz Commercial Cleaning please stand up. Serving the Great Lakes Bay region, Jazz Commercial Cleaning customizes services to meet the customer's specific needs. They service any type of businesses from schools to realtors to churches, medical facilities, office buildings, and more. Thank you, and welcome to the Chamber. And now will the associates of Women in Leadership, Great Lakes Bay, please stand up. Women in Leadership inspires, empowers, and connects accomplished women, growing their knowledge and expanding their reach within the community while cultivating women leaders of tomorrow. Thank you, and welcome to the Chamber. And now will the associates of Core Staffing please stand up. Core Staffing is a healthcare staffing company specializing in nurses, respiratory therapists, allied health professionals, and additional specialty and clinical services staff as needed by the clients. Core Staffing provides services across the United States with a focus in the Midwest. Thank you, and welcome to the Chamber. And now will the associates of Uptown North Maine please stand up. Uptown North Maine is Franklin's newest and most stylish gathering place for receptions, weddings, bridal showers, and celebrations. Banquet rooms can accommodate small to large events and include options like their new cocktail suite. Uptown also houses retail and commercial businesses. Thank you, and welcome to the Chamber. And now will the associates of Versatile Commercial Flat Roofing please stand. Versatile Commercial Flat Roofing offers full flat roof services, including replacement and repair for flat and low slope roofing systems. They are centrally based in the Great Lakes Bay region and serve businesses throughout the state of Michigan. Thank you and welcome to the chamber. And now will the Associates of CrossFit Whip please stand up? CrossFit Whip fosters a community environment where focused classes and programs are developed to offer a full body workout with combined elements of cardio, weightlifting, gymnastics, core training, and more to prepare the body for the unexpected. Thank you and welcome to the chamber. And finally this morning, will the Associates of All Valley Home Health and Hospice Care please stand up? All Valley Home and Health Hospice Care offers a range of health care and hospice services in the comfort of a home environment. Services include pain alleviation and system management by an experienced team of hospice professionals. Thank you and welcome to the chamber. Please make a note of meeting our new chamber members at the perk or during the business card exchange. If you know of a business that would benefit from the chamber membership, please let us know or invite them to next month's perk. And now, JJ, it's back to you.
Thank you, Dawn. It's our premier perk sponsors who make the Percolator Breakfast possible by underwriting all 10 of our events during the year. All of our premier perk sponsors are included on the banner behind me, and we'd like to recognize a few of them this morning. Some of them have even provided door prizes. If your name is called as a winner, please come up to the stage after today's program to claim your prize. And to all of our premier perk sponsors, please stand as I introduce your company. First State Bank. 15 years ago, when many banks were consolidating, a group of local business and professional people felt there was a need for a local bank, one that was part of the community, one that understood the unique needs of businesses in the area, one that was in town and in touch. First State Bank has been growing ever since by providing a full range of personal and business banking services. Today they have 2 locations in Saginaw, 2 in Bay City, and 1 in Midland. First State Bank has provided a wine basket door prize this morning, and our lucky winner is Kenneth Kuhava of Century 21. Thank you, First State Bank. Next, would the employees and associates of Advanced Diagnostic Imaging PC please stand? The subspecialized radiologists of Advanced Diagnostic Imaging are the area leaders in diagnostic imaging and intervention, providing professional imaging services to the region's hospitals, referring physicians, and patients. ADI physicians are fully committed to securing the continued viability of the local medical industry with their strong support and participation in the education of CMU College of Medicine residents. ADI has provided a gift basket this morning, and the lucky winner is Tara Nichols of Keller Williams. Thank you, Advanced Diagnostic Imaging. Next, would the employees and associates of Hammer Restoration Incorporated please stand? Hammer Restoration is a full-service restoration general contractor servicing the Great Lakes Bay region and all of Michigan. Hammer is a family-owned and operated company based here in Saginaw since 1964. With nearly 50 full-time employees, Hammer has earned their reputation as the region's emergency response leaders. Hammer Restoration has provided a $50 gift card to Red Lobster this morning, and our hungry winner is Josh Wheeler of the Saginaw Spirit. Thank you, Hammer Restoration. And last this morning, would the employees and associates of HealthSource Saginaw please stand? HealthSource Saginaw is unlike any other hospital in the region. Their entire focus is recovery. They specialize in getting you back on your feet from surgery, debilitating illness or injury, chemical dependency, or mental health issues. Whether your rehabilitation journey is short or long, HealthSource is at your side every step of the way. HealthSource Saginaw, leading the way to recovery. Health Source has a beachy poolside gift package to give away this morning. It's spring break week at SVSU, so a few folks left without this. But our lucky winner is Andy Brady of Try to Finish. Thank you, Health Source Saginaw. And now it's time to welcome our fearless leader with this month's community update. Please welcome Madam President of the Saginaw County Chamber of Commerce, Veronica Horn.
Madam President. Before I get started here with the community update, I just want to let you know it's March, just so you know. And that means it's St. Patty's Day coming up. So in honor of that, I am not Irish, but probably I am. But somewhere in my background, I am Scottish. And a direct descendant of Sir Walter Scott. Just want to let you know, this is the Scottish tartan for my family. I thought these were pretty cool. And they do have heels, but I still need this thing. So, and again, I want to announce to you that the Chamber has partnered with TriStar Trust Bank and the Michigan Chamber on a really exciting new program. It's a new Chamber member benefit. And here to tell you all about it is Vice President and Director of Retirement Plans with TriStar Trust Bank. Please welcome Jane Hagen.
Thanks, Veronica. Good morning, everybody. Veronica may be Irish a little bit. I am not. I'm 100% Polish, but I still wear green. Good morning. As Veronica said, I'm Jane Hagen from TriStar Trust Bank. Did you guys know that over 55 million Americans do not have access to a workplace retirement program? Well, you may or may not be aware of that, but TriStar has a new exciting program to share with you today. We have recently partnered with Michigan State Chamber of Commerce to develop a multiple employer plan. It's also commonly referred to as a MEP. Well, what is a MEP? No, it's not another acronym in the banking world. We have plenty of those. This is legit. What can a MEP do to assist all those Americans without a retirement program? Well, a MEP is where many small companies come together under one umbrella, offer a 401k plan to their employees. It's very cost effective because all those companies band together to share the cost and to limit the administrative burdens and to come together. It allows small companies to have a small 401k plan that looks just like what the S&P Fortune 500 companies have. So it's quite exciting. Up until this time, many small companies didn't offer a 401k because it was expensive, it was time consuming, and so on. But by having a 401k as part of your benefit package, it's really a great tool in your toolbox to attract and retain superior talent, which we are all looking for today, especially with unemployment at 3.5%. The MEP is great for small companies with existing plans to explore it, because we probably can save you time and money, or for small companies that don't have a plan, we can help you get started. We'd love to chat with each and every one of you, so please join us on March 17th for an informational luncheon. Please sign up at the Saginaw Chamber of Commerce. Again, it's March 17th. It's from 12 until 1. It's St. Patrick's Day. It's on the back of your flyer and your brochure also. So thank you for your time this morning and enjoy the wonderful spring weather this weekend.
Awesome. This really is a pretty exciting program. So if you are interested, I would encourage you to come to that seminar and learn more about it. So I want to thank those of you who brought items. At this point, for the YPN Gives Back CAN Locker Drive, CAN being Child Abuse Neglect Council. The CAN Locker is the newly designed space at the CAN Council developed to provide new and gently used clothing and personal care items to children placed in foster care. Most of these kids, when they come in, they're placed with no personal items. They've come out of their homes in pretty desperate situations, and they only have the clothes on their back a lot of the time. So the items that the YPN work to collect and gather help meet the child's immediate needs and lessen the financial burden and basically the stress of everything they're going through. So the construction of the CAN Council Locker was a project of the 2019 class of Leadership Saginaw County. Woo! See? And the YPN are supporting that effort with the drive that will run through March 26th. So if you didn't bring your donations with you today, there's still time. Additional drop-off sites are at the Chamber, Andrews Hooper Pavlik, Cumulus Media, the Saginaw Community Foundation, and finally on March 26th at the YPN after 5 at Buffalo Wildways. And I'm going to tell you that not just personal care items, but if you're doing spring cleaning and you have luggage that's old, they need that. You know, again, these kids are going into foster care, throwing them into a plastic grocery bag. So if you've got some old luggage, they can use that. So bring it in. Today in your folders, in your PERC folders, you're going to find a postcard with a brief description of 4 ballot proposals the Chamber is endorsing in next Tuesday's election. So the most important message there, please vote. If you haven't done so already, by absentee. Tuesday is the primary election. And these ballot proposals will be on both the Democrat and the Republican primary ballot. The 4 that we have chosen to endorse, Saginaw County Proposal 20-1 is Parks and Recreation, and it's a 6-year millage proposal. The Chamber is endorsing that. It's a quality of life issue. We are endorsing the City of Saginaw Proposal 1. It's a renewal of 7.5 mils for the city. So this is being voted on by city residents only, but as employers, if you have employees that live in the city, encourage them to vote. This is keeping 20 police officers and 10 firefighters on the job. Without the millage, they're gone. We've gone too far in really improving the public safety in our community. That's a critical renewal millage. There's also a 5-year renewal, an increase of 3 mils to 3.2 mils for stars in the city of Saginaw. And the Chamber met with Glenn Steffen and his team. I'm telling you, this guy has done amazing things with stars. He has made the routes make sense. They're on time. They're going where they need to go. He's developing private-public partnerships between stars and a company out in the Thumb that has a dedicated bus that is taking people to work from the city of Saginaw to Pigeon. And it's a round trip. The company's paying for a lot of that, but the employees put they're paying a portion of the ride share, but it's putting people to work. And this is innovative thinking not being done in other places. So once again, we lead the way in innovative thinking and coming up with solutions. So we're supporting that. Finally, if you haven't heard, the Dow Event Center millage is up. We are out there, we are supporting the renewal. It is a restoration. So when you hear they're raising the millage, we are not. 10 years ago, we were very cognizant of the market and the economy, cut that millage in half. And so now what we're asking for is to restore that to the original millage that was passed. You buy a house, you got to put a roof on it eventually, right? That's what they're doing. These are the unsexy things. They need new heating and air conditioning. They need sound system. But those are the kinds of things that are going to continue to attract the top-notch events that come there. I mean, personally, it was Bob Seger for me, but for, a lot of you out there, it's probably somebody younger. But anyway, we are strongly supporting that Dow Event Center millage, so please remember to vote. Get out there. It is the heart of our entertainment district. It was the first thing that was passed to allow a lot of the venues that you see, the Temple Theater, all up and down Washington. So that's a critical millage question that please vote yes. So with that happy note, let's talk about the coronavirus, shall we? So it's out there. Fortunately, we have no cases in Michigan. It will come to us. So as maybe some of you saw on my Facebook, I posted an article from the Wall Street Journal about how do you treat this thing. Treat it like the flu. wash your hands, you know, clean surfaces in your home. Wash your hands and sing. I thought you'd said ABCs while you were washing your hands. I was told yesterday you sing happy birthday twice. So as my employees were coming into the bathroom, going, happy birthday. Anyway, so I just want to let you know that we're not making light of this. We are working with Saginaw County Public Health Department and 911 Emergency Preparedness to help get the message out if and when this comes and how we're going to handle it. You know, the chamber has to consider public events like this. What will we do? We'll try and push out information about how can you work remotely, what are the best practices right now, so we can cope with this and get through it and keep calm in the community. So and then on that happy note, we also signed on to an immigration compact with another several other chambers and organizations around the state, implying or asking that we come up with some common sense immigration laws that will allow our employers to fill that skills gap that exists out there. That's just the bottom line. And so we really need to ask Congress. Who the heck is coughing over there? Don't sneeze on me, bro. Anyway, we are on this immigration compact to encourage Congress to make some common sense laws regarding immigration and the best way to approach that. So we've got some important events coming up in the next couple of months that you might want to put on your calendars. Big strategies for small business on March 17th, St. Annie's Day. We'll have our first big strategies for small business lunch event at Horizons right here. And we'll be talking about affordable 401k plans, and that will be presented by TriStar Trust Bank. So we encourage you to come on out and learn more about it. On the record for breakfast, one of our legislative series, we will be at Apple Mountain, and this will be the first of our public policy bite series. We're going to be looking at navigating through the auto insurance reform. In July, there are mandated changes to the way auto insurers can charge for insurance, as well as what is covered. So some of the changes may impact your health, your health coverage. We hope you can join us as panelists Pete Ewan, Megan Klein, and Rachel Schmidt from Saginaw Bay Underwriters dive into the details and answers questions on liability under the new law, PIP coverage, and who may or may not be covered under your policy. They're important questions that many of us have. Finally, mark your calendars for Friday, April 24th, when the Chamber will hold its 157th annual meeting. Our featured speaker is Dr. Sam Shaheen, President of Shaheen Development, who looks at the timeline of growth and renewal in Saginaw County. We'll also discuss some of the Vision 2020 strategies that have been completed, as well as honor some of the Chamber's most important members, our volunteers. That's it for the community update. It's about time now to stand, stretch, take about 5 minutes, and meet somebody that you haven't met and exchange business cards. Ready, set, go.
so many of you making those great business connections. But if you could please begin making your way back to your seats because it is just that time. If only that guy could sing. And while I have the stage for a moment too, I don't know how they didn't get me one of the red t-shirts, but I really want to encourage all of you to support the Dow Event Center campaign. As many of you know, I worked on behalf of that in 2010. That was part of our Leadership Saginaw Class of 2010, Best Class Ever project. And so I encourage all of you to get out there and support that. Talk to your friends and neighbors when you're outside this weekend when the weather is nice. Make sure you encourage them to get out there and vote. Complacency is our enemy. I think many of us understand what a great community asset that is, but we need to make sure all of us and our friends and neighbors are going out there to support that. And a big shout out to Anthony Taylor for stepping up to chair this year's campaign. We really appreciate all the work that he has done. He doesn't sing as well as Todd Hall. And now I would like to welcome today's speaker sponsor with a brief message and an introduction to this morning's featured presenter. Please welcome Tony Holstein, Business Development Manager for HealthSource Saginaw.
Good morning, everyone. Well, in 1930, Saginaw County Hospital was established as an infectious disease hospital here in Saginaw, now known as HealthSource Saginaw. That small 90-bed facility has grown to a 347-bed rehabilitation hospital and Saginaw County's 10th largest employer. HealthSource has continued to evolve services, meeting various needs for the Great Lakes View region, and most recently in 2018, we started our renovation and expansion to add Saginaw's first and only geriatric beds. We had 16 beds, 8 additional adult psychiatric beds. We had an aquatic therapy pool. And then, to make things more comfortable, we converted our semi-private rooms to private rooms for our long-term care patients. Now I need this. So, we are a rehabilitation and recovery hospital. There's no one else like us in the region. You've heard that a couple of times today. Offering the scope of practice from short-term care to a lifetime care. We offer specialized medical rehabilitation, long-term care, which includes our skilled nursing and skilled rehabilitation area, behavioral health services, and we offer outpatient services for all of our service lines. Well, and the Centers for Medicare and Medicaid Services recently gave us a 5-star rating for quality. And the American Healthcare Association recently published a performance summary of all skilled nursing facilities in the state. It's over 500, and ranked HealthSource Saginaw second among skilled nursing facilities for patients showing short-stay functional improvement. That's first-class healthcare right here in Saginaw. That aside, what makes us unique? We have the most comprehensive therapy gym in the area with over 12,000 square feet of therapy space. We employ our therapy staff. Most inpatient facilities contract their therapy staff. We hire our own, and it helps us better manage outcomes and keep consistency. What else? Well, we're now the only facility in Saginaw that offers inpatient aquatic therapy as well as outpatient aquatic therapy. So on the picture here, this is our new aquatic therapy gym. The picture on the left shows our pool with the floor at floor level. This makes it so patients don't have to get on a set of stairs, they don't need a lift. They simply walk onto the platform and are lowered into the water, or they can wheel on in a wheelchair. The pool goes up to a depth of 6 feet. We have cameras in the pool so the therapist can see what's going on below the surface, views from the front, back, and sides. And this is the same pool used by several professional sports organizations for training and rehabilitation of professional athletes. We have a lot of specialties and programs. I'm not going to list them all off here, but I'll click on them. But we do use some electrical stimulation devices with muscles that help regain function. For those of you who've been out, you might have noticed we have a driving simulator at the facility. And that is used for cognitive evaluations and cognitive retraining. So if you know somebody in Saginaw or the surrounding area that needs therapy for any reason, whether it's a stroke, it's a car accident, a joint replacement, any other medical condition, you have a choice in your rehabilitation care. And there's state-of-the-art therapy right here in Saginaw County. So last but not least, our behavioral medicine center. It consists of 4 different major areas. We have 7 chemical dependency beds for detox. We have 33 child and adolescent beds for psychiatric treatment. We have 60 adult psychiatric beds. And our newest 16-bed geriatric unit. For the past several years, we've been working with the CMU College of Medicine with their psychiatric physician residency program, help us manage that. And that program had over 3,300 admissions last year, 26,000 patient days, and 7,600 outpatient visits, and that was last year alone, helping the people of the region. So, HealthSource is about to meet the needs of the community and helping keep Saginaw a leader in and a destination for first-class medical care. That said, I get the privilege of introducing Dr. George Kikano. Dr. George Kikano became the Dean of the CMU College of Medicine in July of 2015 and the CMU Vice President for Health Affairs in August of 2018. As Vice President for Health Affairs, Dr. Kikano is responsible for the unification of CMU health-related programs, functions and clinical services, as well as aspects of regulatory compliance, quality, information security, and privacy. He also serves as chairman of the board of the CMU Medical Education Partners. Dean Kikano is passionately committed to teaching, community partnerships, access to care, and the college's mission to educate diverse students and train culturally competent physicians to provide comprehensive health care and services to underserved populations in Michigan and beyond. Before joining CMU, Dr. Kikano received his Bachelor of Science and Doctor of Medicine degrees from the American University of Beirut in Lebanon. He completed his residency in family medicine at University Hospitals of Cleveland. He is board certified in family medicine and earned certified physician executive credentials at the American Association of Physician Leaders. Dr. Kikano remains a practicing family physician. He is the recipient of several awards and recognized as a healthcare hero by Crane's Cleveland Business. Dr. Kikano has been active in many professional organizations and is a former president of the Academy of Medicine of Cleveland in Northeast Ohio. He is an active leader and board member for many regional organizations and initiatives. He has published more than 50 medical articles in peer-reviewed journals, and has been an investigator on several federal grants focusing on education and research. Dr. Kikano also has been involved in international projects related to primary care, sponsoring educational conferences in Lebanon, coordinating exchange programs in the Ukraine, and most recently teaching and establishing major research initiatives in China. Please welcome Dr. George Kikano.
Thank you much, and thanks for having me. Actually, when you talked in the past 2 weeks, I've been VP for Corona. I'm serious. I probably spent, just 80% of my time the past 10 days dealing with Corona issues. This is, between students, we have a couple of hundred students abroad. We have faculty going out to international trips. We have spring break coming, so what do you do? Quarantine, all kind of questions. Bottom line, please do not panic. People overseas are making fun of us as a country. How we are reacting to this? Just to put things in perspective before I go through some of my remarks, year to date in the US, we've had over 30 million confirmed cases of influenza. 30 million. We've had 300,000 hospitalization, 18,000 deaths from influenza A and B year to date just in the US. For a disease that has a vaccine and that has medicine. We had 18,000 people die. Worldwide, there's only 3,000 coronaviruses. That's usually they're older and we're compromised with issues, so please do not panic. It's common practice, whether it's corona, flu, or other. Wash your hands, simple hygiene, just common sense makes a difference. We are overreacting as a country. Thanks. One of my staff reminded me, this is my 5th year in Michigan. Short after I was hired to CMU, I was asked to speak at the breakfast, and I completely forgot about it. So much has happened in the past 5 years here. I'll give you some updates. The other things I do not do as an academic, I got 50 slides, pared them down just to one. just joking. So. CMU has done very well. So, for people who know, we've had leadership changes in the past year and a half. We have a new president, Dr. Bob Davies. He's amazing. He brings a fresh look to the university, to the region. He's someone who's thinking way beyond Mount Pleasant, way beyond what we can do at the Teachers College. He's coming with a bold vision, good ideas, and which is refreshing for me, making decisions. We don't always agree, but at least you know what you said and he makes decisions. He's looking at me. High school graduation from Michigan is going down year after year. It's going to be down for the next 10 years. So how do you survive with the higher ed institutions, with less students coming in here? Most importantly, how do you differentiate yourself in the market to get students from the outside? And the vision here is excellence and growth beyond Mount Pleasant. So we've been lots of discussions how to become more relevant to meet the needs of the community. So programs, what are the jobs in the future? What's going to happen in 2030? What's going to happen in 2040? What kind of degrees we have? What degree is going to become irrelevant to position ourselves to meet the demands mostly for this market? The other thing that's happening, when CMU started at a small teaching college out in Mount Pleasant. It's becoming more now a research institution. Research from our perspective brings jobs, brings innovation, brings IP, brings talent, brings dollars to the region, and that's very important. And that transition, while having still community feel for the university. And that the research also is driven by having the health professions, by having a medical school. So having a medical school, which was absolutely the right thing to do 10, 12 years ago, it changes the focus, changes the image of the university, not just locally, but more importantly, nationally. And the kind of things we're talking about on campus these days, what's going to define us, who we're going to be in 2030, and the focus has been well-being, well-being, well-being. I mean this from a physical, mental perspective, environmental, economic, and education. The other thing that's happening is if you work in academics, things move slow and things are very silent. So the Department of Art and Sciences doesn't talk to engineering, doesn't talk to education, doesn't talk to any of that stuff. We are breaking these barriers. So 4 years ago, we said, we came up as 5 colleges together. What can we do what can we do collectively. We started a center called Center for Community Health, Center for Community Health and Wellness. So 5 colleges, 5 deans, 5 faculty, 5 students. How can we make a difference in our community? And that thing have taken off like crazy. So we have an educational program. If you look at it, there's something called ACEs. These are kids who are disadvantaged, kids have been through trauma. We have been leading through that center, ACEs training throughout Michigan. We have a program in Lansing in September, 500 people there. So we're training teachers, we're training students, we're training social workers. So we're getting out of our comfort zone as an educational institution, giving degrees and credits to looking at what's going to be relevant for us in the region here, what's going to be relevant for us nationally, and how we're going to do this. One of the programs I've been working on in the past 6 or 8 weeks is how can we bring neurosciences back to CMU. CMU neuroscience program at some point 10 years ago was one of the best in the country. We've taken kind of a hiatus, but we're rebuilding neurosciences big, both education, both research, and we're looking to build stronger linkages with the Field Neurological Institute in here. Dr. Field, all of you, has been amazing. I've done amazing work. He's looking to leave a legacy for the region. So how can we partner between Saginaw and Mount Pleasant to bring neurosciences more at the regional level, and we're thinking big here. So bringing back to my day job, which is the College of Medicine. People haven't heard, we are starting to have a major shortage of physicians. Physicians and providers, NPs and PAs. Conservatively, over the next 10 years, we need 50 to 90,000 physicians in this country to meet the demands. 50 to 90. Keep in mind, it takes 10 to 12 years to make a physician. So the problem, when I speak to others or so, the problem of 2030 started now. So we have to be prepared for it. If I just look at Michigan, 10 years ago, for the past 100 years before that, we've had 3 medical schools in Michigan. Traditional UFM, Wayne, and MSU. In the past 10 years, we have 7 medical schools now, and the existing one increased their class size, and it's not enough. There's something called FQHCs, which are the safety net clinics, similar to the Great Lakes Bay Health Center. They just opened a brand new $5 million building in Mount Pleasant. I was there last week. Their waiting time, these are the disadvantaged people in our community with insurance. This is not, give me a handout, give me free care. With the Medicaid expansion in Michigan, everyone has insurance. Their waiting list for a new patient is 9 months. This is like, are you serious? 9 months for a new patient disadvantage coming up from a small township or program that are paid for by taxpayer money, federal and state. That's a problem. Commercial patients, in Midland, in Mount Pleasant, in Saginaw, thank you outsource for the partnership. Takes 6 months to see for a new patient to see a psychiatrist in our region. That's not acceptable. And it's not about money, it's about our workforce. So based on that, this is where CMU started that medical school 12 years ago. We graduated 3 classes, about to graduate our 4th. Last year, we had 7,500 US applicants. We're not taking kids from outside the US, a few Canadians. 7,500 for 100 positions, outside US applicants. Next class, we're looking at 8,000 applicants for 100 positions. So I keep saying, by choice and by mission, the guidelines for our admission team is, you take kids from Michigan. We have 80%, so we have 7 classes now, 80% out of 7 classes in a row are from Michigan by choice, not by need. We lose money on tuition. When I say that, I don't want people to get the impression that we're compromising on Michigan because it's Michigan. We're taking quality kids. I call them kids that are younger than my kids. So our students have an average GPA of 3.7. They're quality kids from Michigan that we're keeping here. And our mission is to have them train our region, stay in our region to become our physicians in the future. When they come to us, the way we select, I come from a big Ivy League institution where I spent my career. We didn't take kids from Ohio because we're a national school. My dean said, we're not taking Ohio kids, we need California and the East Coast because we're national. It's different for us. And the way we admit them both. So, or how do you screen 8,000 applicants? We make sure they're going to be successful, but we give them an interview. Based on their interview, their personality, their leadership skills, their fit for our mission, that's going to get them admitted. So when they're working in Covenant, when they're working in St. Mary, when they're working at Health Source, these are well-rounded kids that we treat well, and their success rate now on the board has been above the national average. So they come in smart, we take care of them, they're being very competitive nationally, and we're treating them very well. So we've been fortunate actually with the community. Could not have my job, could not have been successful without Saginaw. Saginaw, I mean, the whole community, I mean, I'm looking at hospitals in here, I'm looking at Covenant, we're looking at St. Mary, we're looking at FNI, we're looking at Health Source, we're looking at Mid-Michigan Health. Could not have done our jobs without the support. 2/3 of our students, so if you do the math, we have 140 students living in Saginaw, training in Saginaw. If you add the beds, I mean, between Covenant and Mary and Health Source, we have close to 1,000 hospital beds in the region, which is important. I mean, we don't think about us as a big region, but we are big in healthcare, come to think about it. We have 1,000 beds, we have 140 students living here. So this is, for me, I mean, this is economic development. And we're fortunate, I mean, I understand hospital competition. I mean, I'm glad that we have hospitals that compete. That improves the quality, that improves things. I mean, it keeps everyone on their feet. We are not in the business of hospitals here. We are in the business of education, research, community development, and we have a relationship with all the players in town and others. More importantly, you've seen what happened last year with us. We signed a 25-year agreement with Covenant in July, and this, I mean, in this day and age, this is unprecedented. This doesn't happen anymore. It used to happen 10 years ago, 25 years ago, but through the community leadership, through the administration, I mean, I'm very thankful for the Covenant administration. That's a 25-year commitment on both ends. So we are committed to stay here, we are committed to expand here, and maximize any students we can do in the region. I mean, the other part of it, there are gaps in healthcare, obviously. I mean, for the whole region, we have no pediatric subspecialty. We have no pediatric training, so this is not, it is the nature of how hospitals operate. So what we did in the past 3 months or so, we signed a deal with 220 pediatricians down in Detroit. So with one signature, and this was not a business decision for me. This was more education, outreach, and visit. I mean, there are no pediatrics in the region, or when you have, it's very small. So January, 6 or 8, we have 220 pediatricians downtown Detroit. They have old white coats, they have CMU white coats downtown Detroit. That's vision, that's expansion for us. The flip side of it is, I mean, we have a meeting coming up a week from Friday to see, I mean, jointly what pediatric subspecialties we need in the region. Whole region does not have a single pediatric surgeon, does not have a single endocrinologist. So to bring service in our community, this is where the leverage comes from CMU Medical School. So I tell my staff, I mean, anytime I spend in my office is wasted time. My job is not to be, I have no interest in being a boss, having a big corner office. I'm interested in making this community better. My job is to make the region better based on my skill set, relationship we have. So bringing the pediatric subspecialties in the region is a community perspective need for us. Down in our building and medical school here, which is about $24 million investment from CMU, we have a $10 million simulation center. If you haven't seen it, please come, email me, we'll give you a tour. So the Children's Hospital of Michigan, which is the only freestanding hospital in Detroit, they do not have a sim center. We're signing an agreement with them in the next couple of weeks to be using our sim center in Saginaw for their nurses, for their social workers, for their mid-level providers, for their 400 residents, and for their physicians. So again, that's business coming from Detroit. So you have freestanding children's hospital with no sim center. They're going to be using here in Saginaw. So they're going to be driving here, staying here overnight, bringing their staff, going to the restaurants, going to the businesses. For me, that's for me, this is economic development. I mean, for things that brings value to the region, bring visibility, bring image to the region. I mean, our image outside here is not the best, but we need to change it, and we will change it. The other thing that happened is mental health. I'm passionate about it for multiple reasons. I'm passionate about it. I remember when I interviewed for my job, actually, there was someone interviewing me here in the conference room. They said, your predecessor just started, or about to start a psychiatry residency. It's costing us $1 million a year. We don't see the value. I have not signed my contract yet. I asked one question. Is there a community need for psychiatry? And you know nothing about the community. I said, absolutely, there are no psychiatrists. I said, you know what, take it out from my package. We're going to keep it. What's our fit? At that time, we had only one part-time psychiatrist working through web access or telemedicine from Arizona. Are you kidding? Fast forward, and psychiatrists are hard to find. Fast forward, we have 12 psychiatrists fully employed. We have a residency program fully accredited. Our first class graduated last year with 4 residents. 3 out of 4 stayed in the region. That's mission. That's mission, and through very creative funding, supports from both the state as well as CMS in Washington, we doubled the size of our residency program. So as of this July, instead of having 4 residents per year, we're going to have 8 per year, and we are going to have a fellowship in adolescent and child psychiatry. And we're thankful to our partnership with HealthSource. I mean, they've been an amazing partner with us. So we have 12 psychiatrists, 8 psychiatrists per year in training, every 3 years. This is valued. The other piece of it, on the mental health side, excuse me. We have in place community programs. I don't know how many people heard about the suicide and suicidal prevention. This is what Bob Smith, Franz, and others. 3 years ago, someone actually, one of the executives at Dow called me, said, George, can you meet with this lady in Saginaw? Barb Smith, never heard her name or something. She was in my office telling me what she does. I mean, 24/7, going up to this emergency room, going to this high school, someone attempted suicide, someone suicided or others. I asked her a question, told her, Barb, where's your office? I don't have an office. We just meet and do program 24/7. Before she left, I never checked the references, knew nothing about her. Literally, I mean, this was a half-an-hour meeting because somebody asked me to do. So let me show you your office. She got an ID badge. She has CMU email. She has an office. She has a computer. And I worked with a person from Dow who asked me to help her. We got her actually 2 grants. She has 3 staff now. She has an infrastructure, and she works side by side with our psychiatry program. So this is how we do it. This is a synergy, how you link academics. For me, academics are not silos. I mean, we're missing the boat if we think, I'm some big boss, somewhere making, there's nothing exciting about being a boss unless you build it out for the community and you outreach them. So, I told them 25% of medical students or residents have been burned out, 10% for about suicide a year. So I told Barb, what can we do for our students? So she started, with the student-led program, suicide prevention, that we rolled it out at CMU 3 years ago. We rolled it out to 7 medical schools in Michigan. It went to the American Medical Association. It became a model around the country. So you start with one thing, you connect the dots in there, you say, when you see value in there, this is not turf for anyone. How can you make them bigger they are? Actually, through a CMU sponsor that went from the Saginaw Medical Society to the Michigan Medical Society to the AMA in Chicago, becomes a mandate for education medical students for burnout prevention and wellness. So it's all happening here. Yep. And this is the fun of the job. It's the fun of the job being a boss and no fun person. Everything that's happening. So as an academic institution, you can leverage resources, even though we have, as a public medical school, have 0 funds from the state, which is completely unusual. Our scholarship, our students are graduating with $275,000 in debt. They're 27, 28 years. This is not college debt, this is medical school debt. So we graduate them, they're passionate, they want to change the world, they want to stay in Michigan. They cannot afford the primary care specialty or they go to the highest bidders. So I'd love to be able to have discussions. We need scholarships to keep these kids in here. And that's economic development. When they establish care here, we treat them well, we treat them nice, we want them here for the future. So there are other aspects of the job that are not so rosy, but we're not in it. The mission is good, vision is good, our business plan is backwards. Having said that, we are one of 7 public entities in the state that can leverage state dollars for something called Medicaid uplifts. So for physicians, healthcare providers, we bring state dollars in here to allow physicians to expand their access to Medicaid underserved population. Just from that program, we are bringing $6 million to Saginaw a year. So we're the public entity, if you do the math, it's probably over $6 million. It's coming specifically to Saginaw. There are other millions that go to other relationships we have outside the region. And this is $6 million coming to the economy here. And from us as a College of Medicine public institution. On the past 3 years, we worked with 3 other medical schools on something called Michigan Docs, Michigan basically to increase training program. I mean, thank you, Ken Horn, thank you, John Melanar, and others who helped us with this. As of this year, even though this hard budget season for the governor and others, we're bringing $5 million in additional funding to expand our residency program here. So we have $6 million coming to Saginaw through us at CMU. As of this year, going forward, an additional $5 million. Again, for training. So about 5 years ago, we had 60 residents. These are physicians in training in the region. In 5 years, we're up to 120 residents. All 120 of them live here. When they sign up, this 3 to 5 year residency program, they're living here, they're spending money in here, they're buying houses in here. And our hope is that outsource, covenant, and Medicare recruit them in the future. So you have 120 people. We have 200 Medicare that we saw between residents and students. We have 300 people specifically in Saginaw. We have another 300 employees in Saginaw. So we're a medium-sized business with lots of high wages, low crime rates. So this is value added, but couldn't have done it if this community did not, was not hosting us, was not supportive of us. Can't come top down or CMU, blah blah blah. It doesn't work. Another thing we've done is we partnered with other academic institutions. We are not here to compete with Delta, with SBSU, with Davenport. This is value added for the community. You see in Delta new facility, they have a need for using our simulation center. Instead of them building their own, which is very expensive, they'll lose money on it. They're going to be working with us using our center after hours, whatever night. So that's partnership for us. We work very well with the SBS. If we look at the roster of health programs, health, not medicine, between SBSU and CMU, they're all complementary. And there's value added for us to work with that. So there's enough for both of us to add value in the market and to work together. I don't see us as competitor as much. So one of the things with SBSU, I don't know if you know that, we have something, so as a College of Medicine, I have an agreement with CMU, partnership with CMU undergrad to give preferential education and treatment for CMU undergraduate. This was predecessor. Within the first 6 months after I started my job, we signed the same agreement with SBSU. So the agreement I have between College of Medicine that I lead with my parent institution, CMU, we have the same agreement with SBSU, and they made it a point back then, because we're here for the region, we're not here for competition and nonsense and other things. I spend probably a good 25 or 30% of my time in community partnerships. This is Mahaya, for example, this is Thrive, this is AHAC, so my job is these community partnerships, and that's going to add value for our region, Saginaw and the Great Lakes Bay region. So we had one of the government leadership from down south here 3 weeks ago. So the person spent three hours in here. This is how they basically brought Detroit from being bankrupt to what it is now. With 5,000 jobs at Ford, how do you keep Ford, GM, Chrysler, and others? Thousands of jobs added through leadership, vision, and some bold decision in Detroit. The person who was here, and we had leadership from the whole community. We had small businesses, large businesses, hospital leadership in a 3-hour meeting 3 weeks ago or so. The person was asked the question, can we bring, since you have Ford and GM in Detroit, can we bring parts and supplies manufacturing? He said, you guys, this is the wrong strategy. Your strategy for Saginaw is going to be ads and nets. This is education and healthcare. Healthcare is the largest employer. Education is going to be the second largest employer. We can make a difference in here. The jobs that can happen, mechanical assembly job that went to China, went to Detroit, went to Mexico, they're not coming back here. The chamber at Saginaw Future, 2 years ago, we got the consultant to look what this healthcare looks in the region from a comprehensive perspective. It's in $2 billion existing at this point, $2 billion industry. So I think the future for our region, Saginaw and the Great Lakes Bay, is not going to be manufacturing with all due respect to businesses or others. It's going to be education and medicine. And we need to just think big, don't think incremental. We need to think transformational. How can we as a region, higher ed institutions, hospitals, come together to put us on the map? Just, if you look at just, I mentioned mental health and psychiatry before. We're the largest provider of mental health services North Ann Arbor and Detroit at this point. Between us and up, between the thumb and the UP, there are no mental health services. There's something called telehealth, there's something called telemedicine. How can we leverage this? How can we attract talent in here? How can we work with our outstanding hospitals? This is Health Source, Mary, and Covenant in here to make us a destination of healthcare. In the previous hospital I worked at in Cleveland, just for one hospital system, we measured what we call leakages, how much business from our position or from our market share leaves the region. This is one hospital system, was $120 million a year. If we do the math for our hospitals and we have good care, we have good hospital and good leadership, we lose so much market share. This is people either from this area, I'm going to go to Ann Arbor, I'm going to go to Detroit, I'm going to go to Mayo Clinic, because either services are not here, access is not where to be, or perception about, which is a perception about poor quality. The other thing that happens, many people drive by for healthcare. People from the town bypass us to go to Ann Arbor, they bypass us to go to Detroit. People, I think, we need to be a destination here. Increase our services, scopes, access, service, change the perception of quality, and this is not impossible, we can do it. It needs just vision, leadership, transformational things. I've seen it happen in Cleveland. I can give you tons of examples, they have lots of stories. I do best by taking questions, otherwise I can go for another hour here. So don't let me go for an hour, please ask me questions. There's no bad question for me, otherwise I'll tell you stories about Cleveland.
Anybody
About Corona.
have a question for Dr. Kikano?
Please.
Yes? Yell it out. We don't have a mic, so.
Could you tell us a little bit more about the medical school that's going to be coming up?
Thank you, sir. So we just put a program, so Larry Preston is a friend of mine. Larry now is at the temple. I told Larry, what can we do for the community here? He said, I can offer the temple, we can just cover expenses or get sponsorship. What can you do? Well, let's put many medical schools, they kind of a wrong label for this. Let's put some educational program around health for the community. And we're just going to start with four sessions this year. So I think one of my staff, Dr. Vladimir, worked with the temple. So we're putting 4 programs, 3 for the community, more about health education and health awareness, and we're hoping to build on it. So this is what it is. I don't have the dates with me, but if you just, check our website. It's a free program at the Temple Theater. 4 sessions coming up April, May, or June, I believe. So please check our website on the medical school. The other thing that's happening, which I got confirmation from this morning, we're going to have the Surgeon General here in May. That's a big deal. So he's going to be here for 2 days. I just got confirmation about the dates this morning when I was here. So if you get the Surgeon General, you have to bid on dates. I need May 22nd, 23rd, if he's available. Then goes to the White House for due diligence, approval. It's a lengthy process. Surgeon General is going to be here for 2 days in May in Saginaw. That's a big deal. And he's looking at what we've done around economic development, tying it with healthcare through Thrive. People don't know about Thrive. I'm happy to give you a thumbnail what it is. So it goes to attention in Washington. What's happening in the Great Lakes region is important. He's coming to spend 2 days with us. And there's going to be a report coming out from just his 10 years so far accomplishment. He's going to be highlighting what's happening in the region here as a model for economic development and healthcare. These are big things happening in our region. We need just to brag about them, put them out for PR, to change the image of who we are, what we do, to attract more businesses and talent to here. And we can do it. I'm not running for office, I get excited when I
Actually, Dr. Kikano, I have not a question, but kind of a statement, and then you can play on it. A lot of people in this room have heard the acronym THRIVE.
Yeah.
Chamber, we have been a partner with the Thrive Initiative since its inception. Yesterday we had a meeting, another meeting, a follow-up. They're ready to move into phase 2 of Thrive, and we know through Dr. Kathy Bazzi, who's leading that effort, that the nation is starting to look at this initiative, and nobody is doing this in the whole country. And so maybe you can touch a little bit about what Thrive is, and
Thank you, Veronica. So actually, our national meeting for medical schools is happening in San Diego next week. So this is for all academic institution. And the meeting next week that just got canceled for Corona again. was also, this meeting coming up for next week was also happening with all the CEOs and CMOs, all the leadership of teaching hospitals throughout the country. So these are like, it's a huge meeting. One of the sessions was for me to talk about Thrive. So I spent my weekend putting things together for Thrive, just got canceled yesterday. So, but this is how much visibility, and I did not, they called me up and said, we've heard what's happening in the region, George, can you present nationally about this? So this is the level of attention. It's getting the Surgeon General, it's getting teaching hospitals, and medical schools. So what happened here is that the region had something now for 12 years called MAHIA, Michigan Health Improvement Alliance. This is what Dr. Kathy Bathy, formerly at Dow, she's not working with her, she's amazing. Started 12 years ago to what we call it, and I see some board members of MAHIA here, what we call a multi-stakeholder alliance. So basically, let's get stakeholders, let's get small businesses, large businesses, let's get employers, let's get hospitals, let's get physicians, let's get payers, let's get pharmacists, let's get drugs. So 15 multi-stakeholders, let's look at the macro level. How can we improve the health of the community? It's not medicine, it's health in general. These are crime rates, this is violence, this is K-12 education. So health from a very broad perspective. So to her credit, Kathy started that 12 years ago. Now they've done lots of good in the community, but they've done it project-based. So when I came here 4 years ago, obviously Kathy reached out, so I started working with her. On the flip side of it, you have something called the Great Lakes Bay Alliance, which is small business development. This is what Matt Valera and other run. I happen to be on both boards. I'm on the Alliance board, I'm on the Life board. So, you know what, healthcare is 20% off our GDP. 1 out of 5, 20% of what we spend as a country goes to healthcare. So we have the economic development arm in the Alliance in here, we have MAHIA in the health sector. How can we work together? So we started brainstorming meetings after meetings. We came up with, let's do something. So what we did, which is very interesting, we mapped the assets for the region. So we figured out as a region, we took out the region as a 4-county. This is Saginaw, Bay, Midland, Isabella. What's where? K-12 education, graduation rate, poverty rate, transportation, quality of care for the hospital, cost of care, number of physicians, specialty of physicians. So we looked at 360, what's happening across the whole region for focus. So we did asset mapping. So I have big work and big drive in my office. I can tell you where things are. And we were fortunate enough to get a couple of grants, all local. We hired a consulting firm. And they came and did hundreds, they came multiple stakeholder interviews. So we went through principals of schools, went to government, went to hospitals, we had higher ed. So they interviewed all stakeholders. They came up with 176 priorities for the region. Then we clustered them into 35 priorities. We take 176, cluster them. This is education, this is health, this is economic development. Then we narrowed down to six different topics. So we know what's the region in here. We know that the priorities from stakeholders throughout the region. Then we put them through kind of artificial intelligence called system dynamic engineering at MIT. So it goes in a program personalized to the region, and they projected what happened between now and 2040. If you were, and what I mean by that, let's say K-12, healthcare, education, transportation, poverty. If you as a region will do invest X, then this is personalized, customized to our region. Your return of investment by 2040 is X. And we used also figure out what are the jobs of the future between now and 2040 for Department of Labor and Stats. Even if you're 10 or 15% off, we're still, we have a roadmap that's personalized. This is not, we need IT jobs throughout the country. We need more software engineers. This is what our region, based on our town, needs in here. So what I was presenting next week is the outcomes of this. If we were to improve, if we were to do nothing, I'm happy to bring it back, bring the slide sets here at some point. So if we were to do nothing, our population is going to go down. Our 18 to 34-year-old kids is going to be leaving the area. With the lower population in here, we're going to see more seniors and less employable. We're going to have more patients on Medicare and Medicaid, less on the commercial. Our access to mental health services is going to go down. So we have a whole dimension of things. But if we were to invest X, Y, and Z in these areas, and we have the 5 topic areas, this is the ROI for them. So as we make decisions as a community or as a region in here, We're going to invest in $100 million in transportation. We can quantify what does it mean, what's the ROI, how many jobs, what kind of jobs we need, how it's going to affect us as a region. So this is what Thrive is about. What Thrive stands for, transforming health regionally in the vibrant economy. So the search in general, I mean, it's all about economic development based on healthcare. There's no model around this around the country. We heard about it. We had meetings with him. Kathy met with him several times in DC. We met him in Ann Arbor when he was here a few months ago. He said, I'd like to come and see it firsthand what's happening. This is the genesis of this meeting coming up in May. So we can be a model if we can do this right here.
Other questions?
Any questions? I'll probably get, if we have time, we can tell stories.
All right, well, let's thank Dr. Kikano once again for this great
Thanks, Veronica.
Okay, so with no glasses on, I was supposed to introduce the chair of the board, Heather Gallegos from Dow, and she is, interestingly enough, on a global call on the coronavirus. So she's out there. But I'm filling in for her. So I'd like to take a few moments to thank this morning's Chamber Ambassador team, who included Lori Barr with Emil Rummel Agency, Saginaw, Britt Schreck with Isabella Bank, Kelly Levere with Saginaw ISD, John Pickelman with TriStar Trust Bank, Scott Reed with Scott Reed, Edward Jones, and Dave Young with Dow. A special thanks too to J.J. Bain with Saginaw Valley State University for always agreeing to MC our PERC series. And let's also thank our premier PERC sponsors. Without them, our PERC breakfast series would not be possible. Be sure to visit their tables on the way out. They're in the back there. They're all staffed and willing to talk to you. We hope you can join us for the Business After Hours next Thursday, March 12th at Stardust Entertainment Center. That's going to be a whooping good time. We look forward to seeing you there. Next month's Percolator Breakfast on April 2nd is right back here at the Horizons, where we'll hear from Saginaw Public School Superintendent Dr. Vermont Roberts about the plan for a new high school in Saginaw and some of the old buildings that will be demolished. It's a pretty comprehensive plan. So we ask you to keep making those connections. Thank you. You're getting out a little bit early, and have a great day. Thanks.